Oh my God, Kelsey, look at her posture. She looks like one of those lazy, hyperextended girls, putting all the weight on the posterior facets. That inner core is like blah. She's gonna get some sort of spinal fracture.
Now this is a story all about the spine, whether you get flipped up, knocked down, or hit from behind. If you'd like to take a minute, just sit right there. We'll tell you how to handle spinal fractures because you gotta be aware. So we've got 4 fractures here today. Your practicing establishment is where they'll come to play. Treatment and assessment are often the same, so in the course is where the general idea will stay. So we'll go in order from A to Z. Talk about definition and etiology. We're gonna talk about end place, then spiny, then wedge. So let's get started then. I was lying on the grass one Sunday morning on Summer Hill, thinking about end plate fractures. A break in the subchondral trabecular bone. This makes up the vertebral end plate in the spine. They are so thin and porous here. They have to be to allow the nutrients to flow, to feed those bouncing in the vertebral discs. You know, they commonly lead
To disc disruption
Small nodes can also occur
with fractures in the spine.
with end plate
In the
fractures.
spine. What is a small node, you ask? Well, it's the squirting of the nucleus pulposus into the vertebral body. This causes a decrease in the height of the disc, possibly leading to symptoms of disc derangement, caused by repeated axial loads, most often inflection.
More common
As people age,
thinning of the trabecular bone.
leads to breakage, it weakens.
In the spine,
It causes,
end plate fractures.
it weakens.
Yeah.
Spondylo, you making me so crazy, making me say ouchie. Why the sudden change? Spondylolysis, a defect in the pars interarticularis of the vertebral arch. Spondylolysis, you commonly occur at the level of a 5 due to great force up above. Spondylolisthesis, defect in both the pars, resulting in the anterior slippage of the vertebrae. Spondylolisthesis, most often an anterior slip occurring at L4 on L5 due to iliolumbar ligament strength at L5, so strong and feeling alive. Spondylolisthesis may rarely occur to the posterior. They both occur with repetitive extension and high impact activity.
Teach me about spotty, huh? Yeah. That'd be like, yeah, unilateral leg extends lumbar extension may cause pain on the ipsilateral side. Patients often present with haplodotic posture and pain during extension. A step off between the spinny ears process may be palpable with spondylolisthesis. Catching pain can sometimes occur as rising up from flexion. Often occurs in the first 2 decades of life. Degeneration of the pars in the elderly can lead to sudden change. Yeah, so
Teach me about spondy, teach me about spondy. Teach me about spondy, teach me about spondy. Everybody's spondy, everybody's spondy. Everybody's spondy, no extension with that spondy.
they'd be like, that pain radiates into the buttocks and proximal thigh during standing and walking. General numbness, tingling, and weakness in the legs may occur. They will often stand in the shopping cart sign position. Treat like how your symptoms are relieved by flexion of the spine. So
Teach me about spondy, teach me about spondy. Teach me about spondy, teach. A wedge fracture within in the spine, caused by an anterior collapse. It then results in a wedge shape that narrows anteriorly. It's often associated with osteoporosis, most common in the thoracic spine, due to kyphotic curvature with too much pressure over time. Don't you know kyphosis can occur? Pain inside and worse by range of motion.
Bending forward and standing up and coming will be so annoying.
Stop right now, avoid anterior compression. Promote range of motion in the posterior direction. Early mobilization to prevent secondary complications. Do 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 do.
Push fractures that we are talking about results from failure with the anterior middle columns often results from trauma inflection. It can be serious as segment spread, and that's about the time you know it's unstable. Nobody likes it when it's unstable. Contact sports and NVAs falling from heights. These are common causes. Get them to the ER, to the ER. Now, usually I don't do this, but this is a little bit of assessment and treatment for the PTs. So it's assessment time, and your history is prime. Gotta find out if there was trauma, their behaviors and jobs. Checking out that posture, gotta expose that spine. Range of motion is able to be restricted most of the time. Commonly negative
Neuroscans,
though there are
exceptions.
so do those myotones and dermatones and dural tension. Somebody, you've gotta palpate up and down. Fractures tend to wear found. Send them over to the docs and image somebody. So now it's time to treat. There are some things that I'll meet. We've gotta focus on education, posture, and mobility. So you must
Educate
immobilize depending.
on the grade.
Then get those cores turned on, cause they've been off for too long. Wanna stay as stable as we can for 6 to 8 weeks, don't move, man. Braces can be used in the acute stages. Oh yeah, we've got
TA on the front
and
motivus on the back.
got to work that inner core, but
Not hip flexors.
so conform with
X-rays.
and conform as you
Palpate.
for history you'll be telling of the mechanism of the injury. It's the remix of 859. Yeah, so what? We love spine. Gotta ensure if it's stable, only do what you're able. Worst aided in the healing, won't stop till we hit the ceiling. It's freaking physio time, baby, so let's have some fun.